pour encore une fois de Topik Konversasyon. Aujourd'hui bon matin, nous rejoignons avec Dr. GUPTA. Bien sûr, conversation qui nous tient commencé et nous pas fini en matinée. Alors, ce qui nous peut faire aujourd'hui, nous pouvons répondre quand nous quitté et bien sûr pour nous capables finir à cause de beaucoup de questions qui sont adressées et nous pas jamais capables finir. Et nous réaccueillons Dr. GUPTA aujourd'hui from Victoria Health Clinic. Bien sûr pour nous capables finir nos conversations et en même temps pareillement dit aujourd'hui nous peut causer une maladie bien sûr qui appelle Osteoporosis. Qu'est-ce que ça, quoi ça, justement. Dr. GUPTA, il a pour lui donner bien sûr son définition. Et si mon cap dit ou en gros, un autre mot qui nous peut dire, c'est bien sûr l'air où les os viennent failles, ils viennent fragiles, et l'air où on vient les os, il n'est pas capable d'adapter avec mon nouveau les os. Alors, ça, son spécialiste, son expert, il a aujourd'hui bon matin pour lui donner plus de détails avec nous. Welcome back, Dr. GUPTA.
Thank you.
Good morning.
Good morning, ma'am.
How are you?
I'm doing good.
Good. When did you came?
I came 48 hours back.
40 years back?
Less than 48 hours.
Less than 40 years ago. How was it? Did you come in the rain? How was the weather when you came?
No, weather was pretty humid and hot.
Hot?
Not raining that day. Sunday, not raining.
Oh, you came on a Sunday, but it was good.
Yeah, it was good, as always.
As always. Doctor, do you want to stay in Seychelles forever?
Why not? It's a good place to stay, and at least, I mean, when you're looking at your retirement, you should be coming here. Because right
You're
now
talking about retirement?
when you're looking at this age, you want to do lot of work. So at that point in time, currently you are globalizing in terms of giving different treatments, the latest treatments in different parts of the world. So at some point in time, why not? Surely.
Why not? Sure. Doctor, you know, il passe son retraite ici, c'est so. We will wait and see.
Sure.
Last time we were there, when you left, we were talking about the surgeries. There were some patients here in Victoria Health Clinic that you were performing surgeries.
Yes.
How are they doing now?
So last time we did around 2 knee replacement surgeries, hip replacement surgeries, and all of them are doing very well.
Yes.
We have had our consultations yesterday, and we saw all of those patients. They're very happy.
Successful?
Very successful. They are very happy with their decisions. In fact, they have brought their family members, they brought their close friends to have a consult and see what can be done for them, because it has made a tremendous change in their quality of life. Secondly, it has broken a lot of myths that they had in their mind. First and foremost, they feel that any surgery is something which is overridden with a lot of complications, and that's where they saw that they recovered. They started walking within 3 to 4 days.
Really?
Yes.
Oh.
After 3 days, 4 days, all of those patients started walking normally without any problems. They are bending their knees, they are extending their knees, they are getting into the car, driving. And
No more pain? No more pain?
No more pain, no more pain, absolutely no more pain. And in fact, they themselves were thinking that why did they not take the decision earlier? Because see, most patients are actually driven by what they see their friends, their peers, or they hear in the media, or they hear from somebody who has taken treatment at the hospital probably, and if they feel that some person has not recovered completely, that's where a negative psyche gets developed around the procedure.
Earlier today,
Yes.
earlier this morning, I was just saying, be very careful about information that you get, that you
Yes.
read. It must be credible.
Absolutely, absolutely. And what we are talking about is actually experience. We have done all these cases, and that's the reason why they've recovered so fast. And we have done all these cases with the minimally invasive techniques. And a couple of those patients, they wanted to actually become ambassadors. They said, "Doctor,
Really?
let us know how we can help you and help the other people in Seychelles who are actually worried about the outcomes of this surgery and all this." So we said, "Don't worry, we will be having and forming communities in terms of like back in India, even in Mauritius, we have these spine communities wherein the patients interact among themselves. They are able to talk to themselves and discuss for those people who are actually suffering from a condition as to how they can get out of it. Not all cases require surgery, but how they can actually be helped is something when these self-help groups come into contact with each other, they help. So they would be doing that bit on their own, but yes, pretty happy with the results of these cases which we have done.
Different cases, of
Different
course,
cases,
have their
yes,
complication,
yes.
but at the end of the day, if they are feeling well, This is the
Yes,
result.
but at the end of the day, the whole importance of doing a minimally invasive surgery, doing it with the best of experience, is that you minimize the complications.
Yes.
So when you've been doing these things for 15, 20 years, you know that you would be able to give the best to your patients, and that's where you sort of step into these procedures. And if you remember, when I came for the first time, and that time in September, I guess, and that time we discussed about the different things that we are going to bring into Victoria.
Yes.
Along with the
You have
MRI.
good news?
Yes, along with the MRI, I talked about doing minimally invasive and advanced surgeries, which at that time you said that is it possible in Seychelles, and I said yes, it is possible, and we did it in December. Now we are seeing the results. We will be doing again a few cases this time around as well. And as far as the MRI is concerned, it's already
here.
It's already going to be here because it's on the containers on the ship.
Really?
Yes, and we are looking at installation by the end of next month. So we should be having good news and launching it by May. So that's how we are committed towards the healthcare and the upliftment of it in Seychelles.
Voilà, vraiment committed. Last time qu'il était là, il dit bien sûr, il peut venir. Ça l'en est qu'il a, en effet, 2025, pour venir à Victoria Health Clinic avec un nouveau l'équipement, bien sûr, bien avancé, une équipe expert, pareil nous dit. Et voilà que le docteur Gupta, il confirmait pour dire yes, qu'il peut arriver CC. Il a un container, n'importe quel moment, il peut débarquer CC at the end of April.
It will be installed, yes.
It will be installed. Et voilà, plus bonne nouvelle pour Cécile. Bien sûr, on a plus soit à présent, par nous dit, pas besoin de déplacer pour sortir Cécile, pour aller à l'étranger, non mort, qui tout bon quelque chose, il a avec vous ici Cécile, que vous pouvez faire. Si vous pouvez sur descendre de Victoria Health, si vous avez l'auto, plus facile encore, n'importe quelle façon, vous pouvez arriver déplacer l'avion, dépenser par accommodation. All the things il a avec lui. Il a porté Paris nous dit quoi? 30 minutes, un état drive au milieu d'un bus pour arriver à Victoria Health Clinic, il est basé en Étoile. Bien sûr, alors, moins de dépenses. Bien sûr, si vous parlez de dépenses, à peu près, 60 000 roupies, parce que avion, accommodation, l'autre, and so on. Qu'il fasse la moitié que vous pouvez dépenser contre Victoria Health Clinic. The doctors are here, the experts are here, the specialists are here. Si on a pour faire ça, mais nous les là-bas. Bring all your problems and communication to Victoria Health Clinic. The specialists are here, là où est capable de guetter qui m'a quelque chose. Il était, par le docteur, il dit, bonne l'opération, il finit de faire, they are very successful surgeries qu'il a fait, tout patient peut masser, n'a pas aucune douleur, alors si vous connaissez bonne patient, capable de gagner un dialogue avec les autres, sinon, contactez le docteur Gupta qui là, si ou encore peut douter, qui a un problème, alors ce moment, quoi, plus qu'il est, pour gagner un contact avec le docteur Gupta à travers Victoria Health Clinic, bien sûr, ou gagner quelque chose. Il m'a assez, tout quelque chose meilleur, il était bien sûr contre Victoria Health Clinic, nous peut cause l'on nous les autres, si vous pouvez faire quelque chose à cause de nous, plus assez, plus quelque chose, plus fine. I'm telling the people of Seychelles, the more we get old, the more our joint, our bones get fragile.
Yes. So that is what is osteoporosis.
Yes.
And I thought we should talk about it because it's a silent killer. Especially
silent killer.
Yeah, because we don't come to know about it. Most people associate
makes us
it,
worried.
Yeah, but it makes you worried. It should be making you a little aware. That's why we are here. And what happens is that most people beyond the age, they start feeling fatigue, tired after some work, start feeling bone pains. They feel it is because I'm aging, and I've seen my mother, my father also complaining of these things when they were 60, 65, 70. It's normal aging. But
is it necessarily true?
No, it is not. It is osteoporosis. And osteoporosis is something wherein your bones strength, the weight of the bones starts decreasing. And that's where they will start becoming tired, they will start becoming painful, even normal activities become difficult. So the most important treatment for osteoporosis is prevention. Try and have a good diet. So
lifestyle change.
When you are making a house, you put the bricks and then you put the cement in between. Similarly, for the bone strength, you're looking at the bricks is the calcium phosphate and the cement is like your protein. So you need to have a good balanced diet in terms of good protein, good calcium content. If you are having a disease like diabetes or you have too much of obesity and all that, that also have an impact on the bone strength. So get your checks done, get your tests done. All these conditions should be under control, and you should be having a good balanced diet along with exercise. Again, very important. Mainly females who tend to have hormonal imbalances around the menopause time, they should be the ones who are looking at having a good diet and exercise. Weight training goes a long way in keeping your osteoporosis away.
This is a recommendation.
Recommendation.
All women.
People think that weight training is for becoming big and bulky. No, even for doing
muscle.
Normal daily chores, doing your work, daily activities, playing with your grandchildren, you need good strength in your legs, in your upper body and everything. You need to lift them up, you need to run after them. All that is something that you can achieve if you are maintaining your weight training part. So osteoporosis is something which comes under the category of a silent disease, because we don't know about it. We just have seen people in the society at this particular age, they will have this, so we will also have this, but that's not right. It is preventable and we can treat it.
It can be cured.
Yes, but if suppose you have been diagnosed with osteoporosis and you have not been able to take care of it earlier, you can even start now. Meet your doctors, they would do a bone density check, and based on that there are some treatments which are oral medication, sometimes some injectables which are able to make the bones strength normal. So that's something which is possible, and don't take it as a normal process of aging, because that can lead to very, very high fragility fractures and problems, because I have seen a few patients this time around who were just having some freak injuries, trying to sit on the bed, they had a jerk, they had a back pain, did the x-ray, there was a fracture in the spine. Now, how did the fracture happen? Because the bones were weak. It's like keeping butter out of the fridge, they become soft, so they can take a bad position also. So these are osteoporotic fractures which if happen, we need to do some treatments for them. Yes, we have minimally invasive treatments for spine fractures, wherein there is a technique called kyphoplasty, wherein with the help of just needles going into the spine, and you are able to go into the bone, put in a balloon, inflate the bone which has got pressed, and fix it up with cement and set it right. So that's what is a procedure called balloon kyphoplasty. That is also possible in Seychelles, and we have done it. So all these things are possible, but because I thought these sort of cases we are seeing, we should be more vocal about it through you, so that we can spread awareness. Already you're doing a good job in terms of our other patients. When I'm seeing them in the OPDs, they're telling us, doctor, I listened to your program last time, I saw you on the TV last time, and you were discussing about some good postures for lower back, you were telling us some exercises and postures for the neck, and we have been following that, and even without consulting a doctor, we have started improving. So that's where you feel good that you are actually into the prevention, and that's the most important part of medicine. Surgery or the treatment is the second part, prevention is the first part. So
early
we should
detection.
be looking at, yes, early detection, prevention, very important.
From our viewers, they are asking about the osteoporosis. I was going to ask that, but some viewers are asking, what is the early detection? What is the early signs?
Early signs is that you will start feeling bone pains, body pains, and fatigue much, much earlier compared to what others of your age might be feeling, or with the work that you were able to do a few months back, and now when you're doing the same amount of work, you're feeling tired and fatigued. You start feeling very, very easily bone pains, somebody holding and sort of handshaking with you, and he is hold you tightly, it's causing pain. Somebody pressing you, massaging the leg, massaging the thigh, it's causing pain without a reason. When you have not exercised, your muscles are not tender and still it is painful. Those are signs. The bone pains are the most important signs of osteoporosis, the early signs. Important to meet a doctor, do a bone density check, and go ahead with the treatment.
It's better to report if you don't know about it, if something wasn't even there, and just now it suddenly appears and you're feeling pain, it's best to report if you don't know about it.
Absolutely.
It can be tricky, the warning signs.
They are very, very tricky, because that's why it is a silent one. You do not present with a severe pain. It can never cause severe pain unless until there is a fracture. But yes, you can present with these different bone pains and decreased capacity to work. So all those are important signs.
Merci, watch out, Cécile, pour ça bonne, bien si early signs qui docteur a peut dire si vous senti ban pas quelque chose qui parti là, suddenly ou gagne ban quelque chose, it's best to report si ou pas connaît, il est capable de confuser, il est capable de tricker par nous dire seulement bon spécialiste il a justement pour capable de voir bien si consulter les autres pour voir si c'est même ça que tu peux imaginer ou bien si capable de quelque chose hein. You never know, capable de place quoi nous peut ça rien mais si on met quelque chose qui gagne détecter tout ça là et ben le docteur il là pour ça et c'est la façon qu'il fait bien si qu'il fait c'est quoi Victoria Health Clinic docteur Gupta est là avec les autres spécialistes quand nous concerne nous les autres et que nous besoin hein par nous dit nous besoin joint pain nous besoin un petit partout quand il y en a pas besoin nous tous les jours nous venons jours privier so nous besoin faire une façon pour venir guetter nous les aussi et venir privier what happens doc when the old bone cannot adapt with the new bones.
You mean that basically when there is osteoporosis
Yes.
and the patient starts having good diet and exercise and everything? Yes.
That's
So
the lifestyle. It changes.
yes. So once you improve your lifestyle, you can, the best part is you can actually get back to what you were a few years back. You can get the same amount of strength in the bones, same amount of strength in the muscles, and as the time passes by, your capacity to walk, your capacity to exercise, your capacity to be active, to be on your legs the whole day improves.
Improves.
Yes, so it is not something that is written in Bible that you have to always with aging you have to go down. No, if you are active and you are exercising well, your bone strength, muscle strength, is everything is good, you can defy age. You can be as active as you want to be.
Is it a good thing to be lazy when you're getting old?
No, absolutely
No.
not. It is just a societal
Pour répondre aux
thing.
questions là.
It is just a societal thing. We think that we have done our bit, we have done our hard work, we have done everything. It is important to enjoy life rather than be
Yes.
lazy. So enjoying means not being in pain, being active, being self-dependent. I mean, you should be completely independent in terms of doing your normal daily chores and daily activities, doing your markets, doing your walking, driving, everything. That's what is called as healthy aging.
Healthy aging, fait tout ça que vous sentez ou l'école. À zone que vous l'école, il y a bonne santé. Par nous dit dans tout. À cause, par exemple, dit tous les jours, nous avons privé, c'est celle qu'on pas pour connaître, qui peut arriver à cause pour sentir ou si on dit monde qui active every day pour sentir les temps où l'école celle qu'on il pas faire pareil habitué faire tous les jours. This is the time to report. I'm saying if you are an active person every day, you're giving all, and one day you find that you cannot give like every day. This is the time. You
This is
will
the time
know.
wherein
This
you
is
have
the
to-
time.
You have to
knew.
look into it, yes.
Yes. And you have to report, bien sûr, avec bon spécialiste, côté Victoria Health Clinic, bien sûr, tous les jours, il y en a bon, différents spécialistes pour différentes maladies, différentes quelque chose. Aujourd'hui, nous pouvons causer avec Dr. Gupta, bien sûr, mais là, en ce moment, qui nous peut causer, bien sûr, somebody is asking if they are obese. I don't know if she or she is obese people. If you are obese, does that mean that that your body cannot support on the knees?
Yes. So in terms of the weight bearing joints, which are your knees, your hips and your ankles, if you are obese, extremely overweight, and
Yes.
you want to lose weight fast with the help of exercises, you make sure that you are doing more of what we call as gradual training exercises, walking, swimming, cycling, all that, rather than doing jumping and jogging, because that causes more strain on the knees, especially if you are using too much of stairs, you are doing too much of like hiking and
Hiking.
jumping, all that causes pressure on the knee.
Jumping jacks.
Yes, all that causes pressure on the knee. But as soon as you achieve body weight which is around 27, 28 of your body mass index, the body mass index you calculate is based on your weight in kgs
In the
divided
kgs.
by your height
The height.
in meters square. So if that is you have achieved around 27, 28, then that's where you can start off with aggressive exercise. But until you are above that, you should be trying to avoid any jumping, jogging exercise, because that has a detrimental effect on the cartilage of the knee. And unfortunately, cartilage is something that you cannot recover. You cannot repair it. So if it is gone,
It's
it
gone.
is gone. Yes.
There's nothing.
So that's what
nothing we
is
can do.
something that the world is moving towards. That's called joint preservation. Joint preservation is something wherein if I want to avoid getting arthritis, I want to avoid getting damage in the knees, and I don't want to do a surgery like my uncle or my aunt or my mother
Don't want to go on the table.
underwent at particular age. My mother went it at 64, suppose, and I don't want to do a knee replacement at that age. How can I avoid? That is something which falls into the category of joint preservation. Obviously, at a younger age, trying to take care of it by exercising and movements, yes. Once you start developing symptoms, it's important to do good and balanced sort of exercise, avoiding some activities like cross leg sitting, doing too much of squats, doing too much of, again, extra activities on the knees should be avoided. Again, it helps in the joint. Plus, there is a very, very significant role of things like platelet rich plasma. It's called PRP, or growth factor injections, which are given inside the knee, which act as a layer of repair for the cartilage, for the tissues inside. Again, you have some injections of gel which can be put inside the knee, which helps in, again, the lubrication and taking care of the arthritis component of the thing. There are some people who have started doing, not here but even outside, I think here also it has come up, wherein they are doing some nerve denervation techniques for the knee, and I have had a couple of patients who have actually underwent it. See, the problem with that is it is good in the early stages of arthritis. Once the patients have bow legs, once the patients have bent knees, at that time, if they do this nerve denervation treatments, it is going to only take care of the pain for some time. But the patient's limp
will come back?
Yes, it will come back. But the patient's limp, when he's walking with a limp, that will never go, because the alignment of the bones has changed. And if the limp doesn't go and you keep on walking because now you're not feeling pain, that's more detrimental, because that's going to cause pressure onto the back because of your limp, and then you're going to end up with a sciatic pain or a spine pain. So in most countries around the world, it does not classify into the primary treatment category when you're doing a nerve denervation. It is a supportive treatment given for people who cannot undergo a surgery. Suppose somebody has a heart issue, somebody has a kidney issue, they have some sort of other life-threatening condition wherein they cannot do a surgery to correct their legs deformity. In those cases, it can be considered, that's what the journal says. And it is not the primary mode of treatment of denerving the nerves. It's just a temporary technique with very, very guarded results, because of the fact that it leads to a little bit of a denervation. So the patients feel pain free, they are able to walk, but with a limp, that causes its own downsides and side effects. So any treatment which the patients are opting for should be based on their age and stage of the disease. If the stage of the disease is advanced, they should not go for these treatments. They should definitely be, after they have seen the specialist, looking at a permanent fix rather than temporary treatments.
Permanent rather than
yes.
Doctors, from our viewers this morning, I am a chronic spondylosis person, and lately I'm having severe pain and sometimes very hard to some movements I do. Is there any surgery to help me relieve the pain?
So he has not mentioned about cervical spondylosis or lumbar spondylosis. So if he is having something in the neck part wherein there is a spondylosis, or it is called as arthritis of the joints of the spine, it can very easily be fixed with non-surgery. There is something which is called as facet joint injections, facet joint lasers, rhizotomies. There are treatments which are done. These are non-surgical in terms of there is no cut, nothing. It's just with the help of needles, minimally invasive treatment which can be done for spondylosis. And if the intensity is increasing, it can easily be treated and fixed here in the country. We have all these techniques and all the equipments for the same. So it's not going to be a problem to fix it. It's just that one needs to see if there is any associated nerve symptoms, any associated neurological issues, then the treatment might differ. But just for spondylosis pain localized to that area of the neck or the back can be easily treated with fluoroscopic guided facet joint treatments.
Voilà la réponse pour aux questions, mais seulement vu qu'on pas dit nous qui bon localisé ou spondylosis, mais seulement bien au report pour capable bien gagner résultat bien sûr docteur donne nous la réponse, mais si ou pas assuré plutôt au report, you will be done till when?
I'll be here till Friday night.
Friday night, ça veut dire on entre aujourd'hui jusqu'à vendredi pour capable passer un petit coup contre docteur Gupta et titiller dans Victoria Health Clinic en Sétoile pour get un petit peu bien sûr get côté où il est localisé dans spondylosis pour les capable et lui axe docteur. This one is in Creole. Quand on demande ça, monsieur, c'est plus tard, le temps fini faire l'exercice pour gagner avec. It must be an athlete. They're asking if after when you have done some exercise, later will you be infected?
Will you be?
Will you get affected after exercise?
So, if you have done good exercises, obviously it helps to maintain the muscle mass and you will feel the benefits of it. But people who have actually been into powerlifting, who have been into very, very heavyweight training, they are the ones who can have downsides of that exercise because it leads to a lot of effect on the knee joints while you're doing your heavyweight squats, on the lower back when you're doing your deadlifts, and on the shoulder joints if you're doing heavy military presses. So these are the people who actually, if they're doing very, very heavy exercise in terms of powerlifting and all that,
like the weightlifters,
they
bodybuilders,
they have joint issues going ahead in life. Definitely.
Voilà la réponse pour votre question. Maybe let's stick to the sports injuries that athletes sometimes they can face. Sometimes one individual, they get injuries like 3 to 4 times a year.
So see, in terms of sports, there are two types of sports. One is what is called as a contact sports. So contact sports are like football, American football, rugby,
basketball.
Yeah. So they are contact sports. So you get a lot of injuries and all that. In those cases, you tend to, because you fall down, you get hit, the chances of getting injuries to the shoulder, to the knees and the ankles, these are most common sites. The bigger joints like the spine, the hip, they are preserved. So in these cases, if you have ligament injuries and there is a complete tear of the ligaments, again they can be repaired, they can be reconstructed with arthroscope, wherein you just put in a small camera inside the joint, you repair the shoulder ligament or the knee ligament or the ankle ligament, and it's very, very easily possible. Yes, the recovery period after you've done a ligament reconstruction to get back to sports is usually about 6 to 8 months. It takes that much of time. But if you have minor injuries, they can easily be treated. Minor injuries are just like ligament pulls, partial injuries. And in those cases is the role wherein we get these patients who have who play racket sports.
Racket sport like tennis, badminton.
Badminton, tennis. They tend to have a lot of elbow pain, that is called tennis elbow or golfer's elbow. These cases we've been treating with a lot of growth factor and PRP stem cell injections, and they've had perfect results in terms of getting back into sports within 10 days, 15 days. Patients having heel pain because of their jumping sports. Those sort of cases, again, we do a lot of PRP injections. For tendinitis in the shoulders, again for racket sports. Or these days, even for people who are doing a lot of computer work, we're sitting all day, so using the mouse the whole day, so they get a lot of shoulder tendinitis, again that can be treated. Wrist tendinitis treated. All these are into the category of sports injuries, wherein they're not playing sports, but because of particular postures and everything, you get these tendons, which are the attachments of the muscles to the bones. They become thick or hard or inflamed, and taking long-term medications or physiotherapy, if that doesn't help, in those cases stem cell injections and PRPs are the way to go. In fact, in professional sports, they do not even go for that longer treatment. They just on the second day or the third day of these things, because their career is at stake.
Even the recovery time is not that long.
Yes.
For professional athletes.
Absolutely, because once they have got the stem cell and the PRP injections and everything, they are back to sports within few days, because it does not take too much of a recovery cycle. It's being prepared from your own blood, the stem cells.
Isn't it necessarily good, not fully recovery?
No. If you are incompletely recovered and you go back into sport, the chances of having a repeat injury or a repeat trauma is very, very high. So you should completely recover.
You will go back to the bed.
Yes, that's true. If you have to be into professional sports, you have to give proper time for it to heal. There are many, many big players in cricket, in football, and these players who sometimes have severe injuries, who are given a rest for about 4 weeks, 6 weeks, because that's the body's cycle of recovering you fully from that condition, because you have to again go back to the same sport with the same technique of running or playing or throwing. So that is going to cause a repeat injury if it is not fully recovered. Always you have to respect time. Time is the best healer, but yes, along with the stem cells, growth factors, injections and treatments, you can definitely make it
And there's a follow-up
easier.
as well, the checkup and
Absolutely.
follow-ups.
Very important, always.
Bon athlète, là, nous pouvons toujours un petit peu aussi. Ici, c'est tout bon sport qui est vraiment actif, qui contact, par nous dit, dans le football, nous dans le basketball. Bien si nous pas trop en hockey, ici, nous pas ça, mais seulement, il est vraiment important. Prevention is better than cure, par nous dit, early detection à cause de ça là. Il concerne nous les autres. Si tout là, nous faisons tennis, si nous doit bien gosser, nous pouvons servir tout le temps, même quantité, et même côté. Alors, tout ça là, il est important à cause de nous comme ça, comme ça. C'est ça cause nous doit nous servir c'est le côté it's not that parallel tout ça là sous sentir douleur pour besoin capable rapporter more questions. Yes, doctor, they say if any surgery is done, is it true that in the future you can become paralyzed?
If that was it, then I would not have been a surgeon for the last 16 years.
16 years.
Yes. So when you are actually doing a spine surgery, suppose, with the current techniques that you have, wherein you use microscopes and endoscopes, you cannot injure or hit a nerve, you cannot injure or hit the spinal cord. That is as far as the spine surgery is concerned. But for other limb surgeries like upper limbs, your knees, your ankles, your hips and everything, there is no chances of touching the nerve. So what is the chance of becoming paralysis? This is like saying that what are the chances of having paralysis if you are having ankle surgery? You cannot have. So that's a wrong notion. You cannot have
voilà. Il n'est pas vrai, par le docteur il dit, si nous mettons dans ce contexte, dans le vrai créole, il n'est pas vrai. Ça, ou pas pour paralyser. On n'a pas aucun endroit qui dit ou pour paralyser. This one says, good morning. Ask doctor if replacing of bones can be possible or not by surgery. What remedial can be done?
So that's what we just said, that in terms of replacing the bones or the surfaces of the bones, it is only possible by the help of surgery. As far as non-surgical treatment is concerned, you are looking at treatments wherein we talked about joint preservation. So try and be as active as possible, try and be as exercising and muscle strength and good diet and all those good techniques to be followed, and your joints will be preserved. You will not have a problem.
Voilà.
Just don't abuse them. Just use them.
Pas abuser, par docteur Indy. Voilà la réponse pour les autres questions. Nous comptons aujourd'hui, bon matin, nous pouvons adresser un sujet qui intéresse les autres, qui peuvent envoyer les autres questions. Continuez à envoyer les autres questions. Le D88, 89, 89. Docteur Gupta est là justement pour lire, répondre aux autres questions. Pareil, nous dire que la conversation, bien sûr, qui nous peut continuer, nous peut causer nous bonnes les autres, nous peut causer nous bonnes soins, ben vieux les autres, tout ça là. Pareil, m'ont dit tous les jours, nous venons pour les vieux autres, rapporter comment vous êtes senti un petit douleur. Early detection. Early signs, warning signs, it's best to report. In a report, Dr. Gupta will be there until Friday night, Côte Victoria Health Clinic. So, donnez un petit call or just walking, mettez un appointment avec Dr. Gupta, the group of specialists is there. So, if a patient say it's coming today, just walking without calling.
Better to do a calling so that they don't have to wait for a long time. But yes, if they have not been able to go through and pick up the calls, they can definitely come tomorrow, because for today we know schedule is a
You fully booked today?
Yeah, a couple of surgeries. So that's why.
Couple of surgeries today.
Yes, so I would not be able to accommodate them. But from tomorrow, definitely yes, we will be able to do it, because today's surgeries are those knee replacement surgeries which are with computer navigation, minimally invasive. So it will take a little bit of time.
Pendant un petit peu surgery aujourd'hui, mais seulement pas perçu pour call aujourd'hui, pas perçu call aujourd'hui, mettez appointment pour voir Dr. Gupta, sinon qu'à passer demain, à cause aujourd'hui pendant un peu surgery, mais seulement passer et faire avant vendredi soir, Dr. Gupta va consulter ou bien si vous avez assisé, the best way is that you sit and consult and you see how the best doctor can help you. Si vous avez un petit moyen de PS, de portefeuille, considérer ou problème pour gagner solve. Without any pain, no more pain. N'a pas occupé nous qui commence, nous dit limping, mas boiter de temps en temps, nous boiter, nous comme petit douleur, nous boiter. Maman quoi là, il est temps pour bien sûr rapporter continuous limping, doctor.
Continuous limping can be because of weakness in the nerves, like sciatic from the spine. It can be because of a knee deformity. It can be because of the pain, or it can be because of the ankle issues. Somebody has had an ankle injury, did not treat it that time. So we need to find out the actual cause treat it accordingly, because if the limp is not corrected, it can lead to a lot of other associated difficulties in the spine and the other joints.
Voilà, la réponse qui peut gagner donner aujourd'hui bon matin pour d'autres bonnes questions bien si qu'ils autres peut donner. Si vous faites joindre nous, si vous faites joindre nous, docteur pour la jusqu'à vendredi soir pour qui demande jusqu'à quand docteur pour la jusqu'à vendredi soir, si vous faites joindre nous aujourd'hui bon matin, we've talked about sport injuries, preventive orthopedics.
Yes. So we just, whatever we started talking today and whatever
Mm-hmm.
we have discussed today has all been in terms of preventive orthopedics. When you're talking about osteoporosis, again, you're doing prevention of having bone injuries, of having fractures in the spine and other parts if you're doing a treatment for osteoporosis. When you're talking about joint preservation, wherein you can take care of your joint linings and the cartilage with exercises and stuff, that's again something which is preventive orthopedics. Before orthopedic surgeon can actually come in, you can prevent it. So plus postures, when you're doing right postures and right exercises during your whole day, when you're working, your neck, your back and everything is taken care of, that's again preventive orthopedics. When you're playing sports and you're wearing some protective gears and you're actually strengthening your muscles according to the typical sport, in that case again it is preventive orthopedics. So preventive orthopedics is something which is coming up latest because of the fact that you want to avoid most of the population ending up with a doctor in the consultation room. So you can actually talk about exercises and postures and doing the right things the right way, and the amount of time that they spend on the digital platform in terms of a mobile or a laptop and everything has a lot of bearing on the neck muscles, on the lower back muscles and all that. So yes, all these fall into the category of preventive orthopedics when you're talking about exercise and stuff, which is again available at our center at Victoria, wherein we have these doctors who have started to teach the people the right postures and exercises. We have physiotherapists available on the clock in terms of giving you the best exercise routine according to your job, which is tailored and customized according to you. So that's what these things they are doing, and trying to prevent the disease rather than after the disease has happened, you are taking care of it.
Yes, get taking care of. Nous pouvons causer un petit peu là, ça petit bout de le preventive orthopedics. Ben c'est quelque chose qui est capable d'éviter, ben si pour rapporter, pour nous dire la table l'opération, ben si as long as it can be detected early, doctor, yes, it can be cured.
Absolutely.
Confirmé là.
It can be cured with medications.
With medications.
But if it is detected late, it can be again cured with surgical treatment.
With surgical.
So it does not mean that you have to live with it. It can be treated.
It can be cured, it can be treated as long as it detects early. S'il vous plaît, si vous voyez ça, early signs, rapporter le plus bonheur possible à cause nous connaissons pas notre traitement. En même temps, it can be cured. Pareil, docteur Indy, et madame qui demande une question, demande sa docteur. Doctor, this person is asking if your bone is growing under the feet, what can you do?
So there is this condition called calcaneal spur for people who stand a lot of time or who walk barefoot for long durations. There is an extra protective bone which forms on the heel part, and that becomes painful. That's called as a calcaneal spur. In most of these cases, the tissue gets stuck to the spur. So in these cases, we give an injection of stem cells into that area under X-ray guidance live. And that's how you are able to relieve it, and it has about 95% success rate when you're doing this injection. But yes, you should have prevention in terms of wearing a little high heel and soft shoes, trying to avoid walking or standing barefoot, and strengthening your calf muscles, which are going to take most of the load rather than the heel part. Obviously, decreasing the weight goes without saying. When you do all these things, if it's still not working, then we can do your stem cell injection whenever you want. Not a problem.
There's the answer to your question. We've got more. Ask the doctor if excessive bleeding occurs during surgery. How is he going to deal with it, as Victoria Clinic do not have blood bank?
So I'll tell you again, very good question. Most of the orthopedic surgeries, when you are doing, they do not require blood. When we are doing a knee replacement surgery, we cut off the blood supply by doing a tourniquet tying before the surgery, and after the surgery is being done, all the 3 cases that we did last time, none of them required blood, because their pre-operative investigations revealed that their hemoglobin was good, and after surgery it just dropped by 1 point, which is good enough to recover post surgery. As far as surgery is concerned for the hip, obviously there are minimally invasive techniques which are into play around the world. In all these joint surgeries, the requirement for blood is in less than 6 to 8% population. So tell them, your viewer, that's a good question, but only 6 to 8% of cases would require blood in the post-operative period, and for that the surgeon or the doctor would be able to gauge the case beforehand and would not be going ahead with it if required. And if any of these cases are there wherein there is low hemoglobin or something, there are techniques which are called auto transfusions, wherein the patients can be planned for a surgery in the next couple of months. You increase the patient's hemoglobin levels by good diet and medicines, and then you can go ahead and operate when you have after 6 weeks or 8 weeks when the blood levels have improved. But during surgery or after surgery, the requirement for blood is very less in these.
Very limited.
Yes, because these are all minimally invasive techniques. They are not the old age, old times, long cuts, long surgery healing, nothing. No, that's the reason why MIS is inside.
Voilà, pour retirer doute pour qui demande sa question, not at all. They need a blood bank, bien si vraiment limité, qui sont pour besoin blood bank. Some viewers are asking how to get in contact with you. What is your contact number? Can they call directly for Victoria Health Clinic?
Yeah, absolutely. They can call directly at Victoria Health Clinic. Our girls are there. They would be able to give them the time and the appointments according to their schedule, and we can definitely help to solve this problem of pain for them.
Comme si pas trop tardé à cause docteur pour là jusqu'à vendredi soir, alors soit aujourd'hui, demain, jeudi et la journée vendredi, bien sûr pour un appointment pour voir docteur, bien sûr contacter, c'est ce que donne un petit call côté Victoria Health Clinic, ça qui là, il peut masser téléphone, il va prendre ou bon early ou bon premier document, bien sûr, et là on est capable gagner un rendez-vous, bien sûr pour voir docteur Gupta, bien sûr on fait avant. Vendredi soir, tout ça là, bien sûr, qui nous peut causer aujourd'hui, justement, nous peut causer l'ostéoporosis. Aujourd'hui, quoi ça? Nous ne connaissons quoi ça? Aujourd'hui, si vous sentez ça, bon, si et symptômes qui nous causent là aujourd'hui, vous pouvez aller à parents, vous pouvez sentir, it's best to report, spécialiste là, docteur Gupta, il a jusqu'à vendredi soir pour capable de passer. Et nous tous un petit peu, le bon sports injuries, bien sûr, yes. For your question, if you have just joined us, it can be good. Only if it's early detection, it can be
and the
safe.
right direction and right training for avoiding sports injuries. Most of these people have their coach, they have their trainers, and they know about what sport is liable to cause which injury. So they actually work on strengthening that part of the muscles. But if still you land up with sports injuries, we can easily treat them.
Voilà la réponse. Et bien si nous pour terminer, but before we conclude today, doctor, we need to let's talk about the benefits of everything. We've talked about preventive orthopedics. Let's talk about all the benefits now.
Benefits of surgeries?
Yes.
The joint. Okay. So when you're talking about the benefit of joint replacement surgery,
as a tool.
Okay. So I mean, when you're doing a surgery, and after the surgery the patient is back to normal life, the quality of life improves, they have been in pain, there's societal thing wherein they are not being able to go to the social gatherings, social meetings, or meet their friends and families because of their restriction to stand, to walk, to even get out of the car. So those things are taken care of, and that's all something that can happen within 4 to 6 weeks of the surgery, where the patient is actually active and able to do these normal activities pain free. The joints become mobile, the patients feel good, confident, because they become independent. As far as spine patients are concerned, like yesterday we did a surgery for a patient who had a slip disc and it was causing severe pain in the leg. This guy had been in pain for last 6 months.
Really?
Yes, and he had been to the hospital a couple of times, but he's not improving. So we just with the help of a small camera, we went inside, endoscopy, and we went inside, removed that fragment of the disc which was causing pressure on the nerve relieved. The patient woke up in the morning today with no pain. We met him before discharging him, and by the afternoon he'll be discharged home, because there has been no major cut. It is just the size of a pen which goes inside.
Which
endoscope.
goes inside.
Yeah, it's endoscope. And so it is, the benefit of MIS is that the patients are back to normalcy very, very soon compared to the conventional times. Plus they are pain free, their quality of life improves faster, and they don't have to be on the bed for a longer time. So they become confident of themselves. Most of the patients who are actually suffering from conditions like this guy, I'm talking about 5 to 6 months, 51-year-old guy. Now he started feeling depression because he feels that there is no treatment available for him. And after having treated him and talking to him in the theater, because all of our techniques that we do, the patient is awake, he is able to talk to us. So while we are doing this technique and he's seeing on the screen everything, he was gradually started feeling confident, feeling happy that there is treatment available for this condition. And that's what gives you as a doctor the satisfaction, because you are able to treat the patient's actual condition and the problem. So
solution pour votre problème, c'est cela. C'est la demande aujourd'hui bon matin, on solution pour tout problème, pour tout douleur, pour tout partout quand on cause il y en a, et ça là il y en a ici c'est celle sans qu'il y ait besoin voyager, sans qu'il y ait besoin payer un ticket d'avion qui pas vraiment bon c'est comme là, et sans qu'il y ait besoin à payer encore accommodation. Tout ça là, it's just a drive away to Victoria Health Clinic. Quand nous bon docteur et que nous bon spécialiste, il a bien sûr qui est capable sauver at one go, hein, capable de trouver solution pour le problème. Pas qu'on est sur besoin à faire ça ou pas, mais seulement early detection, ça qui nous peut dire bon matin, early detection. Yes, there's cure et fait quand Victoria Health Clinic call. Bien sûr, au appointment pour voir Dr. Gupta, nous pouvons cause incisé aujourd'hui, mais sûrement il y a des autres spécialistes qui là, qui le bandent les autres incisés. Bien sûr, quand Dr. Gupta, on va gagner consultation, bien sûr, quand vous sentez dans besoin dans les autres, nous pouvons venir vous priver tous les autres, tout à mon petit, mon répéter. Si vous pouvez guetter, nous prenons soin avec nous l'école par expert palital, vous sentez vous pouvez commencer à boiter ici, boiter là-bas, ça boiter, pas arrêter, report. Nous causons early signs, bien sûr, tout ça là. Ou bien rapporter, because it can be tricky, et capable de confuser tout simplement. The doctors are here, the specialists are here, so ou capable, bien sûr, rapporter. Dr. Gupta, absolute pleasure again this morning.
Thank you. It was a pleasure being here, interacting with you, and knowing that people are actually watching this program. They are actually following you and your talks, and it is making a difference in the patients' lives as well, because now they are into prevention. That's what we discussed from the first day. And if they start feeling any symptoms or something, they are coming to the clinic to show themselves, so that the disease does not aggravate into a severe condition going forward. So it is making a difference in people's life, and that's what we are here for, you and me both.
Yes, voilà. Mon posé se fait un dernier check pour que ce n'a pas aucune question qui ne tombe, qui m'ont pas de voix. No. Every question has been answered. Yes, on a pour faire ça veut dire ou qui peut écouter même si on pas de nos questions, pour écouter très attentivement. Just give a call to Victoria Health Clinic. Go and see Dr. Gupta, but do it before Friday night, please, because he will be leaving Friday night. Alors ça, faire ça dialogue avec Dr. Gupta, bien sûr, mais tout. Nous dit cartateur, la tout petit douleur, il était la Dr. Gupta, il y a qui m'a dit, il pour aider et c'est ça, c'est notre topic. Konversasyon.